Our next area is a little trickier. We're talking about dissociative and personality disorders, some of which are controversial and often hard to define. Dissociative disorders are characterized by disturbances or changes in memory, consciousness, or identity due to psychological factors. It's dissociative in that one disassociates the mind from the body, the environment, or the situation. There are several specific types of dissociative disorders. Dissociative amnesia is a partial or total loss of memory that occurs after a traumatic event and has no physiological cause. In many cases, memory returns over time and with therapy. Fugue occurs when a person loses their sense of identity. This is often accompanied by amnesia and the creation of a new identity. It's also accompanied by unexpected or unplanned travel away from home. Recovery can be spontaneous and may occur years later. A more common disorder is depersonalization, characterized by feelings of unreality, separateness from self and the environment. Many young adults actually experience these symptoms at one time or another, but of course this does not indicate the presence of a disorder. An actual diagnosis is only given when the symptoms are reoccurring, persistent, and induce high levels of anxiety. Dissociative identity disorder, or DID, is the most controversial of the dissociative disorders. Formerly known as multiple personality disorder, it is characterized by the presence of two or more distinct identities within one person. The original personality is often, or is always, unaware of the other personalities. But the additional personalities are conscious of the original and of each other, if there are more than one. Each personality maintains its own distinct identity, name, and behavior patterns. This can include different accents, different histories, different mannerisms, and there's been a lot of arguments as to whether or not this is a real disorder. There's, in one famous case, under examination, brainwave patterns changed when the patient switched personalities. And brainwaves are sort of like fingerprints. Everybody has their own distinct brainwave patterns. So this was originally thought to prove the existence of a separate but real identity. Later studies, though, replicated that same change in brainwave patterns in people that did not have DID. So that the debate continues as to whether this is a true disorder or not. So how do we explain DID and dissociation in general? Well, just general dissociation is a relatively common response to traumatic experiences. People often report feeling detached from their surroundings and even their own bodies, seeing things as if they were watching a movie, for example. So this is a normal response to traumatic events. In people with dissociative disorders, the dissociation experiences are more extreme, more frequent, and the symptoms disrupt everyday functioning. One explanation, the learning perspective, says that the experiences themselves are inherently rewarding. It's novel, it's different, and thus highly rewarding, and may be subconsciously induced. We want that feeling again, so brain patterns change and we experience the same symptoms again. It's also been suggested that DID is a fad and may in some cases be brought on by the therapists themselves. For example, asking leading questions to psychologically vulnerable patients, like, is there anyone else in there I can talk to? Could bring on the appearance of another personality. And this would be as a sort of a coping mechanism for the patient who has other more pressing disorders or a disorder. So personality disorders are equally hard to discuss. For one thing, it's very difficult to define a line between sort of strange personalities or those that are outside of the norm and that which is a true disorder. we have to go back to our definition of disorder, right? Is it distressful? Is it maladaptive? Does it inhibit normal functioning? And typically, personality disorders are recognizable by the time the person reaches adolescence. Narcissistic is a term that is frequently thrown around without much consideration. Narcissistic personality disorder is marked by grandiose sense of self-importance, preoccupation with fantasies of success or power. The individual often feels a need for constant attention and praise. Has inappropriate reactions to criticism. This could go as far as paranoia. May be indifferent, overreact to stimuli, and feels sort of entitled to favors without any sense of reciprocity. So this is beyond just a personality type, as we've talked about in the past. Narcissistic personality disorder is disruptive, right? It actually does inhibit normal functioning in society. There's an occupational dysfunction there. Now, some have argued that there could be healthy and unhealthy narcissistic styles. By definition, in this particular slide, all of the characteristics on the right would be considered narcissistic disorder. If these were presented by the patient, we would say that a person presenting with these symptoms has a narcissistic disorder, as opposed to just a particular personality type. Antisocial personality disorder is a well-researched phenomenon marked by long-standing patterns of irresponsible behavior, hurting others without any guilt. The individual does not experience shame or really intense emotion of any kind, frequent violation of social norms, and this often starts early in life. May even begin or be seen as early as 3 to 5 years old. We see frequent criminal acts and a tendency towards impulsivity. There are strong indicators for a biological basis for antisocial personality disorder. This may be related to amygdala sensitivity, the absence of mirror neurons, low level of autonomic arousal, and this leads to fearlessness and a lack of empathy. When controlled and channeled into more productive pursuits, this can lead to sort of an adventuresome or curious personality. But in the absence of responsible guidance of any kind, it can lead to destructive behaviors and harmful behaviors to the self and to others. So these are some types of dissociative and personality disorders. Therapies for these disorders vary and can sometimes be as controversial as the diagnosis itself. We'll talk more about this in the therapy treatment.